Hello everybody, I'm Dr. Anil Kamath. I'm a senior consultant surgical oncologist, and today I'm going to talk to you about how esophageal cancer is treated. In our previous video, I have discussed the signs and symptoms and how esophageal cancer is diagnosed. So let me proceed to the treatment of carcinoma esophagus. Now, broadly, there are three treatments for cancer of the esophagus. One is surgery, chemotherapy, and radiation. Now, once the patient presents to us with a diagnosis of cancer, we see that it is properly staged. What stage is it in? Has a PET scan been done? Has a CT scan been done? So, based on this, we arrive at a stage which may be from 1 to 4. 1 being a highly localized cancer inside the esophagus, 2 and 3 being intermediate cancers, and 4 being an advanced cancer which has metastasized. Very early cancers which are confined to the mucosa can be treated endoscopically through an endoscopic resection. But it is very uncommon, at least in India, to get patients in this stage. What we get is more advanced cancers, either in the intermediate stages or in the more advanced cases. Now, as the cancer advances, early cancers are treated more with surgery, and as cancer advances, it is treated more with a combination treatment. So, we frequently have patients who undergo all the modalities of treatment. Most of the time, chemotherapy and radiation may be administered before surgery to facilitate surgery. This way, the tumor shrinks in size, making surgery more amenable, and the results also which we get are superior to what we get by offering surgery directly. Let me concentrate on the surgical aspects of esophageal cancer. The surgery which is done for esophageal cancer is called esophagectomy. Ectomy means removal. So when you remove the entire food pipe, the procedure is known as a esophagectomy. It's a very major surgical procedure. It carries a lot of risks of morbidity and mortality. It requires a great deal of expertise to perform this type of surgery. And also the setup is also important because the patient may need multiple specialties like cardiology, pulmonology. He may require a good ICU. So esophageal cancer is preferably treated in major centers which are well equipped to handle these type of cancers. So how exactly is a esophagectomy performed? The removal of the esophagus can be done by three modalities. One is the traditional or open method, in which the thorax is open and the esophagus is removed. The other ways of doing it is a laparoscopic method, and the third is a robotic method. The main advantage of doing this surgery laparoscopically and robotically is the pulmonary complications. What happens when we give a big incision on the thorax is that there is a lot of pain, and because of this, the patient is unable to breathe well, is unable to take deep breaths. So, this frequently leads to lung infections. This can, to a great deal, be offset by performing the surgery laparoscopically or robotically, where through a keyhole method, the esophagus is removed. So the pain will be much lesser and the patient will be able to breathe far better. What are the complications associated with esophageal surgery? As I said before, it's a major surgery, it carries a lot of complications. The replacement of the esophagus is done with the stomach. So after removing the entire food pipe, what we do is we tube the stomach, bring it up through the thorax, and join it in the neck to the remainder portion of the esophagus. So the complication which we fear most is a leak. Sometimes the area we join between the stomach and the remainder of the esophagus, it does not heal well and leads to leakage. This can cause a lot of problems, including death for the patient. Then there are other complications which may not be directly related to the surgery, like patient may end up with lung infections, he may end up with cardiac problems. So esophagus surgery is not something to be taken lightly. It has to be performed by a very experienced surgeon, then only you can get good results. It is not a surgery to be done occasionally. And second, it is to be done in a major, well-equipped center, without which the patients can end up with a lot of problems. Thank you.